Today I'm going to review Follistim, which is a stimulation medication. Okay, Morgan, so for Follistim, when you receive this at home in your package, you're going to see you have a Follistim pen, and this item does not need to be refrigerated. And then you're going to receive Follistim cartridges as well. And the color of the box, it just depends on the dose. So there's silver, gold, or blue cartridges that you could receive. This medication is going to tell you that it needs to be refrigerated upon receiving it. Okay, so you would go ahead and grab this out of the fridge when you're ready to use it, along with your Follistim pen. Okay, so the first thing that you're going to do is you're going to open up your Follistim pen box, and inside of here you're going to see there's a green case. As well, you are going to be given a sheet with all of your medications on it. Okay, so if you looked at this sheet, you would see that there's the Follistim pen that it shows you right here. So inside of this green case, you have a navy blue pen, and then there's a bunch of cups with pink paper on top, and they're just the needles that get attached. All right, Morgan, so when you're ready to use this, once again, you have your needles there, you have your medication cartridge out, and then this is the pen. So the first thing you would do is take the pen out of the box, okay? And then there's a cover on the pen. It has the hook on the one side, so you would just remove the cover, and then you'll see that half the pen's yellow and half is blue. So then what you're gonna do is take both your hands and twist the pen apart from the middle so that you have two pieces, okay? This side has a plunger sticking out of it, and you'll see the yellow side is hollow inside. This yellow hollow side is where you would load the medication cartridge into, okay? So your medication cartridge that you take out of the fridge, I recommend taking each cartridge that has to come out of the refrigerator out 15 minutes prior to doing your injection so you don't have a cold, uncomfortable injection, okay? So you'll see that the shapes align, how the yellow tip tapers, the medication vial tapers as well near the rim. Okay, so the rim side is the side we drop face first into the pen because that's the side that gets punctured by the needle. Makes sense, right? Okay, from there, after you put your cartridge in, you're just gonna screw the pen back together so you have one piece. Okay, and from there, now that we have our cartridge loaded up, we're gonna dial up to our dose. So there's a little dial at the end of the pen with the window. Okay, so let's say your dose was 300. Your dose is 300. So you dial the pen up to 300, okay? You'll notice once you're there, you can't dial the pen backwards. Let me go ahead and try that out. Okay, so in the event that you dialed past your dose, you would have to dial the pen all the way forward till you see the number 450, then a little return arrow, and that will allow you to smoothly dial the pen back down to 0. Okay, from there you would just carefully redial to your dose. So we have our cartridge, we would have our dose dialed up, and then from there you're going to attach a needle. So before each use, you're going to clean the yellow tip of the pen with an alcohol swab, okay? So you would take out one of your cups. After you clean it, just gonna peel back the paper on this cup. Let's see. And then you're going to stick the yellow tip of the pen into the cup, and you're gonna twist to the right with some firm pressure. And when you pull that cup off, you're gonna have a needle attached with the safety cover over it. The area that you're going to inject into is our abdomen. We're gonna go 2 to 3 inches away from your belly button, either to the left, to the right, or below. So anywhere in that U-shaped area, just not going above the belly button on either side, you're safe to inject, okay? So at this point, now that you have your needle ready and you're getting ready to do the injection because your pen's all set, it's ready to go, you're just gonna wash your hands, okay? Take a seat. I recommend sitting down to do these injections. It's just easier to pinch the skin up this way, regardless of who's doing the injection, if you or your spouse is going to be doing it, okay? So then when you're ready, you're gonna select your site, and you're going to carefully uncap your needle, clean the skin with an alcohol swab, and then you're going to pinch the skin up to create a little pocket-like pouch for the needle to go into. Then you're going to go straight in with the needle, all the way in at 90 degrees. You're gonna push on the button on the end of the pen to dispense your dose. You'll see that the number in the window goes down to 0 after you dispense your whole dose. Then you're just gonna hold it there for an extra 5 seconds to make sure you got everything. Gonna remove the needle from your body. You're going to take that same cup that you attached the needle with, and you're just gonna push back into it and twist to the left this time to detach the needle, okay? And then this little cup would go into the sharps container. All right, so now that you've loaded the medication cartridge up into the pen, it's good to be out at room temperature for 28 days, regardless if you put it back into the refrigerator or not. It's going to be good only that 28 days. So I recommend putting the cap back on your pen, leave it loaded up, put it back in its case, and put it on your nightstand or wherever you please. Also, another thing, so you're going to be doing these injections daily. This is most likely one of the first medications you're going to be starting with for your cycle. I recommend rotating sites daily. So let's say day 1 you go on the right side of your abdomen, day 2 below, day 3 the left, and so forth. So that way you're giving yourself a break in each area daily. Okay, so then for storage for this, like I said, this can be out at room temperature up until we complete the whole vial. And every time we do have to take one of those medication cartridges out of the fridge, a new one, opened one, try to take it out 15 minutes prior to doing the injection so you don't have a cold, uncomfortable injection.